We do not offer every plan available in your area. Currently, we represent approximately 15 organizations which offer over 100 products nationwide. Please contact Medicare.gov, 1-800-MEDICARE, or your local state health insurance program, SHIP, to get information on all of your options.
What happens when you don't sign up for Medicare on time? Well, here to talk about that is Jae Oh, author of Maximize Your Medicare. Jae, welcome.
Thanks for having me, Bob.
So I know firsthand, I had a friend whose wife is almost turning 65, and he wants to make sure that she signs up on time, and he's very fearful of what would happen if he doesn't. So I know this problem is affecting many people, the 5 million people who are turned 65 every year or so, give or take. What do they need to know?
Well, peak 65 is here, Bob. This is the phrase being coined by the Alliance for Lifetime Income, where I'm education fellow at the Alliance. And that means that this year, more people will turn 65 than any year in U.S. history. It is the most common question, which is, do I have to enroll in Medicare for people who are not working, for people who are married to a retiree and covered by that retiree? Timely enrollment in Medicare is a must. And this is very important because, in fact, just like you pointed out, and since we last spoke, someone was wrongfully told by their employer or a representative of the employer about their requirement to enroll in Medicare. Well, they believed it to be true, sounded credible, felt credible. The person had a business card that suggested so. Nevertheless, it wasn't true. And that was years ago. We couldn't go back into the time capsule to undo this type of late enrollment penalty, one which is permanent. And not only that, it results in higher Part B or Part D premiums or both. And those penalties never go away. They are not one-time penalties.
Yeah. So what is your best advice that someone in the 7 months in which the 3 months before, the month of, and the 3 months after sign up for, at a minimum, Part A and perhaps Part B and Part D, assuming that they don't have employer-sponsored health insurance either on their own or through their spouse?
Sure. The very first day that someone can apply for Medicare in benefits is the first day, 3 months prior to when Medicare would begin. And for newcomers, that means the first day of a month that someone turns 65, unless they're born on the 1st, in which case, crazily enough, it begins the prior month. So I tell people in public whenever I present that if you're a New Year's Day baby, your actual Medicare begin date is December 1st, and now not January 1st. Don't ask me, Bob. They're not my rules. Anyway, 3 months prior to that, you can apply at socialsecurity.gov. You can also turn in paper forms to your local Social Security office. That should do it. Your date will be the first day of the month that you turn 65. From there, you're free and clear, meaning that your Part A, Part B can be active. Then you would have to select a Part D plan or Medicare Advantage plan that includes prescription drug benefits, or you may, for example, be eligible for VA prescription drug benefits, which can all be something Medicare calls credible coverage.
Right. So assuming that you don't have employer-sponsored health insurance at age 65, either on your own or through your spouse, you sign up for Medicare Advantage, Part A and Part B, but you don't sign up for Part D. Is there a penalty for late enrollment in Part D?
So we've got actually 3 different types of penalties. So that is part of why I wrote Maximize Your Medicare, because of the confusion amongst these different penalties. So yes, the answer is there are multiple different types of penalties, one for Part B. There's actually one for Part A, which is very rare. And then there's one for Part D as well beyond today, but it is important that you can't have a break in coverage for a specific time frame, which, as I said, the complication here is that the amount of time you can do without health coverage is different than the amount of time that you can do without prescription drug coverage without penalty. The easiest, the most stress relieving way is simply make sure that you know these rules well in advance, just to reduce the anxiety involved, because there's still work to be done after you have enrolled in Part A and Part B.
Right. Let me go back to my the individual who had employer health insurance, working at age 65, signs up for Part A, and then maybe retires at age 68. They won't necessarily incur a penalty for enrolling in Part B after they retire, assuming it's within a certain time period. Is that correct?
That is correct.
Yeah. And how long do they have after they retire to sign up?
That's an excellent question, Bob, because they actually have an 8-month period, which is what I was saying, that there are different time frames here. I don't encourage that. Generally speaking, when people come for our guidance, we try to make sure that they understand that we don't suggest a gap, if you will, between the time that they're covered from their employer to the time that they enroll in Part B. That said, there can be outlier situations, for example, where that may be a path. But like I said, the number of instances as a percentage is very, very low.
Yeah. So ultimately, if folks want to avoid signing up late for Medicare, they should, among other things, read your book, Maximize Your Medicare, and sign up for your newsletter.
Well, of course, that is the one path of doing. There are many. Don't get me wrong. I'm not the only who will have similar types of guidelines. That said, I wrote Maximize Your Medicare in everyday language that people can understand, but also with the idea that every person's situation can be very subtly different, which may mean that their approach also be different than their friend, their sibling, for example, their past work colleague, their neighbor. That one size certainly doesn't fit all.
Yeah. Well, Jay, as always, thank you for sharing your knowledge and wisdom with us. It is, as always, greatly appreciated.
The privilege is all mine, Bob.